Everyone, we're going to be going over the different modes of inheritance. And there are a few different inheritance patterns that we'll be going over. There's autosomal recessive, autosomal dominant, X-linked recessive, X-linked dominant, and mitochondrial. Okay, so based off this pedigree, can you tell me what type of inheritance pattern this is? This is an autosomal recessive inheritance pattern. And just to make note of it now, the circles denote the female sex, squares denote male sex, the orange shade means affected with disease, while the gray shade means unaffected with disease. So to inherit an autosomal recessive trait, both parents have to at least be carriers, which means they have to have one functional allele and one defective allele. So they don't have the disease, but they can pass it on to their offspring. So let's start by drawing a Punnett square. If both parents are both heterozygous, then what's the chance their offspring gets a defective allele from each parent? So they would have a 25% chance to get the defective allele from both parents, because each parent has a 50% chance to give the defective allele, and 50% times 50% is 25%. Also, if you look at the Punnett square, this offspring here would be the child who gets a defective allele from both parents. So what's the probability that the offspring of two heterozygous parents is also a carrier? So we could go back to this Punnett square here. So we have two heterozygous parents, and we're looking at what the chances of having offsprings that are also carriers. Well, that would also be 50%, which again you could see here, this offspring and this offspring would both be carriers. They'd have a big A as well as a little a. Lastly, there's a 25% chance or a quarter chance that the child would be unaffected at all, where the offspring would have two unaffected alleles, which is denoted as big A and big A. Now, most autosomal recessive diseases are mainly due to enzyme deficiencies and is generally only seen in one generation, which you can see depicted here in this pedigree. Consanguineous families or inbred families have higher risk of these diseases as well. There are many examples of autosomal recessive diseases listed in your book, but a few included are cystic fibrosis, sickle cell anemia, albinism, Friedreich ataxia, and Wilson's disease. Another way they can ask you questions is giving you a vignette and describing a kid who is affected with an autosomal recessive disease, such as cystic fibrosis. They say he has a sister who was not affected and ask what's the chance she is a carrier. There's a 2/3 chance that she's a carrier, right? Since again, going back to our pedigree, we already have the patient who's affected with cystic fibrosis, so this is out, and you have 2/3 chance of being a carrier. In summary, autosomal recessive diseases usually only have one in the generation and is common with inbreeding. Can you tell me what type of inheritance pattern this is? It's autosomal dominant. How are autosomal dominant traits inherited? Well, you only need one copy, so only one parent needs to have this allele, but that means that the parent also has to have the trait and have the disease. And we're going to use big A as the dominant allele. And if dad is a heterozygote, for example, let's say Marfan's disease, his allele would be big A and little a. This would also mean he has a disease and phenotypic characteristics of the disease as well. If he marries an unaffected woman, her alleles would be little a and little a. If they had kids, then what would be the chance that they would have affected children? Well, let's fill out the Punnett square. It would be 50%, right? Because dad has given his big A allele to half of his children, so this half will be affected with the disease. So what if two heterozygote individuals for Marfan's disease have children? Then what would be the probability that they had affected children? You see that there's a 75% chance that the children or the offspring will be heterozygote individuals as well, and there's a 25% chance that there will be one offspring that's homozygote and unaffected. So all three of these offsprings would be affected with the disease, while this one is unaffected. So what if dad was homozygous for Marfan's disease and he had children with an unaffected woman? We see that the dad gives the affected allele, the big A, to all of his offsprings, meaning all of his offsprings will have the disease and be affected by the disease as well. In real life, most autosomal diseases are heterozygous in nature, since a homozygous form is typically fatal, but anything goes on examinations. Meaning one gene contributes to different phenotypic effects, and the phenotypic effects vary between affected individuals. There are so many autosomal dominant diseases, Marfan's disease being a popularly tested one, but others include achondroplasia, myotonic muscular dystrophy, familial adenomatous polyposis, Huntington's disease, Li-Fraumeni syndrome, and neurofibromatosis type 1 and 2. Some take-home points is that this inheritance pattern occurs in all generations, which you can clearly see in this pedigree chart. Okay, so now on to the X-linked diseases. What type of inheritance pattern is this? It's an X-linked recessive inheritance pattern. X-linked recessive disorders are more likely to occur in males because males only have one X chromosome. So if the gene on that chromosome is affected, they will have the disease and they will have the trait. Which parent will males inherit an X-linked recessive disease from? Right, their mother, since they get a Y chromosome from their father. Females need to get 2 affected copies to fully have the disease, which is pretty uncommon. Why do I say fully have the disease? So only cells that have X chromosomes that carry the disease as their active X will be affected. However, this would be a less severe phenotype than in males, and in some cases isn't even detectable. For example, color blindness is due to an X-linked recessive mutation, but if even half of female cells are able to detect color, she'll probably never notice anything unusual about her vision. Now, if a female gets a defective allele from each parent, then what do you expect to see in her parents? Well, her mom could be a carrier, so you wouldn't expect anything unusual, but her dad must also have the trait, since a dad only has the X chromosome to give. So if he gives his daughter a defective allele, then he must also have the trait. In summary, sons of heterozygous mothers have a 50% chance of being affected, and there is no male-to-male transmission. There are several X-linked recessive diseases you need to be aware of, and some highly tested diseases include Fabry disease, G6PD deficiency, Hunter syndrome, Leishmanian syndrome, and Duchenne dystrophy. And some take-home points for X-linked recessive disorders is that men can only get the disease from women, so from their mom, and affected females must have an affected dad. Alright, what type of inheritance pattern is this? It's an X-linked dominant pattern. So looking at this pedigree, what would be a giveaway that a familial trait is X-linked dominant? Well, notice the father here gives the disease to both of his daughter, but did not give the disease to his son. That's a main characteristic to know in X-linked dominant diseases. Fathers transmit to all daughters, but not to any sons, which makes sense, right, since the dad only has one X chromosome to give. However, these diseases can be inherited from both mother and father. Mothers can transmit the disease to 50% of daughters and sons. See here on the left, this affected female here gave the disease to 50% of her offsprings, which resulted in her son having the disease, but not her daughter. Fortunately for your exam, there aren't a whole bunch of X-linked dominant diseases that you have to be aware of, but if you include Fragile X disease, Alport syndrome, and hypophosphatemic rickets disease. Hypophosphatemic rickets is an inherited disorder resulting in increased phosphate wasting at the renal proximal tubule. You'll see a rickets-like presentation, such as bowed legs. The takeaway point here is, women can transmit to 50% of daughters and sons, while men transmit the disease to all of their daughters. And there are a few different inheritance patterns that we'll be going over. There's autosomal recessive, autosomal dominant, X-linked recessive, X-linked dominant, and mitochondrial. Now, what inheritance pattern is this? It's mitochondrial. Since everyone's mitochondria comes from their mother, these can only be passed down through the maternal lineage. This means all of the offspring of an affected woman will be affected, at least to some degree. Variability in expression in these diseases is common due to heteroplasmy. Can you recall what heteroplasmy means? It's a presence of both normal and mutated mitochondrial DNA, resulting in variable expression in mitochondrially inherited diseases. Examples of these diseases include mitochondrial myopathies, which are rare genetic disorders that present with Mila syndromes, or mitochondria, encephalomyopathy, lactic acidosis, and stroke-like episodes. These diseases are secondary to failure in oxidative phosphorylation, and muscle biopsies often show the characteristic ragged red fibers, which is due to diseased mitochondria in the subsarcolemma of the muscle fiber. Leber hereditary optic neuropathy is another example of a mitochondrial inherited disease. It is due to cell death in the optic nerve neurons, which will lead to subacute bilateral vision loss in teens and young adults. Why do you think retinal cells or neuronal cells are typically affected in mitochondrial diseases? Well, the mitochondria produces energy, so any defect here would cause the most problems in cells that require lots of energy, which include the retinal ganglia cells and active neuron cells. So in summary, this inheritance pattern, the mother will give disease to all of her offsprings. Alright, so now at this point, I know you're probably thinking right now, do I really need to know the inheritance patterns of all these diseases? Well, the short answer is no, you don't have to memorize all of them. I didn't take the time to sit down and memorize it all, but you will get lengthy vignettes describing a disease that you 1000% know. It could be Lesch-Nyhan syndrome, could be Alport syndrome, for example, and the question stem simply ask what the inheritance pattern is in this disease, and then you blink. Those are the easy recall questions that you don't want to miss. There are a few mnemonics in your book to help you memorize this, so be sure to check them out. Thanks for watching. If you liked the video, give it a thumbs up.